Okay.
Right. So if you've read and understood considering it surgical pathology station, please begin and have a look at this image. Just pause. This is the image this is the condition with which patient is suffering from. What would be your provisional diagnosis?
It could be malignant melanoma.
Very good. Yes.
Yes.
How would you confirm the condition?
By taking biopsy
Yes. And
and immunohistochemistry study
yes. Okay.
and yeah, and study of the and take history and physical examination.
Yes. Yes. That is the most important part. Okay. Right. Right. What are the causes with which can lead you to think that patient could be suffering from malignant melanoma? Or in other words, what kind of condition is malignant melanoma?
Malignant melanoma is a malignant change of the melanocyte. The thing that make it worry if it is increasing in size or
Okay.
itching or bleeding
Yes.
or change in this nervous.
Yes.
Yeah.
Okay. What treatment can you offer the patient suffering from malignant melanoma?
It could be surgical excision
Okay.
or microsurgery, micrographic surgery,
Yes.
or radiotherapy, or
Okay.
cryotherapy,
Yes.
or chemotherapy,
Yes.
or radiofrequency ablation.
Okay. Right. What kind of condition is malignant melanoma?
What?
What type of
Malignant.
condition is it? Like, is it
It
inherent?
is a malignant. It is a
Yes.
malignant, malignant cell of the melanocyte. It could be inherited by, in case of and xeroderma pigmentosa,
Yes.
and in case of uh, xeroderma pigmentosa and scleroderma.
What are
No,
the
no.
different types of malignant melanoma that you are aware of?
Acral type, nodular type, and superficial spreading type, and
Please
acral
tell me about the desmoplastic type of malignant
desmoplastic.
melanoma.
Yeah, a desmoplastic melanoma. It's occur in case of in the hand and feet.
Okay. It occurs on sun-exposed areas, and
Okay.
it's a rare type of non-pigmented lesion. Okay, please tell me what are the differential diagnoses that one can consider when it comes to malignant melanoma?
It could be malignant melanoma. It could be basal cell carcinoma, superficial squamous cell carcinoma. Oh, yes.
Okay. There could even be malignancies like lymphomas,
Okay.
yeah, metastatic squamous cell carcinomas, etc. Right. Patient with malignant melanoma presents with a hypercoagulable state.
Mm.
Why? Can you explain the pathogenesis behind it?
Hypercoagulable state because the patient with malignancy is immunocompromised.
Okay. Yes.
So there is consumption of the coagulation factor,
Yes.
and yes, this because the consumption of our he is taking chemotherapy. He's receiving chemotherapy or radiotherapy.
Okay. Can I ask you to define the term melanoma?
Melanoma is a malignant cell of melanocyte,
Of epithelial melanocyte?
epithelium. Yeah,
Yes.
epithelium.
Mainly arising in skin and can arise at other places as well. Okay, how would you differentiate malignant melanoma from squamous cell carcinoma? What are their major differences?
Squamous cell carcinoma is arising from uh, epithelium of the skin,
Okay,
while the melanoma from melanocyte itself.
from the
And yeah,
lower layer of the
of the-
epidermis,
yeah,
from any
and
part of the body, yes. And
by immunohistochemistry also.
okay, what
Uh,
about the difference on biopsy? What would be the difference between malignant melanoma and squamous cell carcinoma? How would you differentiate it?
Melanocyte is presence of melanin inside the cell, while
Okay.
the epithelium there is no melanin in the cell.
All right. Okay. Please tell me what are the skin conditions which are associated with melanoma?
Skin condition,
Yes. For example, xeroderma. Yes.
pigmentosa,
Yes. And
and I forget this one.
what is the white one, which is called
Oh,
albinism, right?
albinism, yes, yeah,
Yes.
albinism. Yes.
So these are the congenital types. Which genes are involved in this case? In case of malignant melanoma, what are the genes which are involved? You know many of them. So one of them is BRCA2. There could be
Braccato.
two. Yes, you know the BRCA. Yes.
I forget them. Yes.
Okay.
Barca. Yeah. Braf gene.
Yeah,
Braf. Braf
BRCA2.
gene.
Yes. There could even be
Braf.
CDK4. There could be MC1R. There could be CDKN2A.
Okay.
So these are the genes. Okay. What is the poor prognostic factor when it comes to malignant melanoma?
The most important is the thickness of the melanoma. The
Okay.
other thing is vascular or lymphatic invasion.
All
The
right.
other thing is the presence of distant metastasis.
Okay.
Also, the uh, the
Okay.
thickness. Yeah.
Male gender as well, old age, ulceration, and the site. Like if it is look, it is found on the lower limb, upper limb, or the trunk, head and neck, then it's poor, very poor prognosis. All right. What are the other risk factors when it comes to malignant melanoma?
Risk factor.
One is immunocompromised patient. Second is
Yeah.
past
Immunocompromised
history.
population.
Past history of melanoma. There could be red hair or people who are exposed to sun. And then there is Hutchinson's melanostic freckles. Like some people have those freckles already.
Okay.
Right. All right. How would you differentiate between histology and cytology? Tell me the definitions of both, please.
Histology is a study of the tissue,
Yes.
and it is basement membrane and connective tissue.
Yes.
While the cytology is a study of the cell itself, without seeing the stroma or
Good.
basement membrane.
Okay. Please, last question. What is epithelioid melanoma?
Epithelioid melanoma is a tumor of the epithelial cell.
Yes.
Uh, I forget this
Okay.
one.
Right.
Yes.
If we come back to this stem, you've read it. Where exactly would you examine this patient? Where would be the primary lesion?
I will examine the primary site at
Yes.
first,
Yes. Where
and
would be the
then
primary site?
the site of melanoma, then
Yes.
the lump itself, and draining lymph node. Also,
Yes.
I will examine the brain and abdomen and pelvis for metastasis and thorax for metastasis also.
Good. Good.
Primary site and secondary for metastasis and
Yes.
lymphatic drainage.
How would you know about the phenotype of the tumor?
phenotype,
Yes.
phenotype of the tumor
Yes.
by
By.
histochemistry
Very
or
good.
genome. Yeah.
Yes. Very good. Very good. Very good. Okay. Right. Thank you. Excellent. If you could describe the lesion, because they can
Uh,
give you image and they can ask you to describe, please.
at first, I will describe the site. Where is the
Yes.
lesion
Yes.
and size of the lesion and the
Yes.
shape of the lesion. Is it
Yes.
oval or rounded or
Yes.
triangular?
And
And the surrounding tissue, is it
yes.
inflamed or not?
What
Is
do you
there
see
any
here? Is it crusted? Is
see
it
a crust? I
ulcerated? Yes.
see central crust.
Yes.
No bleeding.
No bleeding.
Yeah, it's bubule like or
Yes.
raised
Raised.
jewel over
Yes.
yeah, and
And black in color.
black in dark black in color,
Yes.
circular, 1 by 1 centimeter, crust over it, no ulceration.
Very good. Okay. Good. With that, we'll call it the end. Thank you.